Good day and welcome. This is the National Emergency Operations Center COVID-19 briefing for Friday, the 2nd day of July, 2021. I am Les Roy Williams. Thank you very much for joining us for our briefing today. We continue to update you on the management of the COVID-19 pandemic here in St. Kitts and Nevis. And of course, we thank you for joining us because your keenness, your attention to these briefings help us with the management of the pandemic here in the Federation. So thank you very much. Without further ado, I would invite to the podium our Chief Medical Officer, Dr. Hazel Laws, who will present us with the Health Emergency Operations Committee Situation Report for Friday, the 2nd of July.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. My task, as per usual, is to share with you the situation report for today, July the 2nd. It's been 1 year, 5 months since we've been responding to the COVID-19 pandemic. Last March, between March and July, we fought the first wave of this pandemic. And so this year, 2021, on May 19, we identified the first case in this wave. And over this past 6 weeks, we have added 431 cases to the Federation's COVID-19 tally. To date, 160 of these individuals have recovered, meaning within the last 6 weeks, 160 cases have recovered. At present, we have a cadre of nurses and physicians monitoring the 268 active cases. At present, we have 8 COVID-19 or 8 individuals diagnosed with COVID-19 admitted to the Joseph N. France Hospital on the COVID ward. So at present, 8 individuals who are diagnosed with COVID-19 are admitted to the JNF General Hospital on the COVID ward. At present, or to date, we have recorded 3 COVID-19 related deaths. This map highlights or shows the areas where the COVID-19 cases are concentrated. And you can see the clusters were identified in St. George, St. Peter's, St. Mary, along the East Coast to Christchurch. So this map highlights where the outbreak is concentrated, shows the parishes where the outbreak is concentrated. This slide highlights the epi curve, and you can see that we started seeing a rise, a surge in cases from around about the 6th of June, and then the plateau continued until round about the 23rd, 24th of June. And you can see the trend is downward at this time. And so we are getting a handle on this wave or this current wave of COVID-19 cases. The public health measures that we are employing, they are working. Now this slide summarizes the outbreak at present, and so we have reported a total of 476 confirmed cases of COVID-19, 17 cases for Nevis, and 459 cases St. Kitts. As I said before, 205 cases have fully recovered, and this is between last year to present. A total of 205 persons have fully recovered, and we are monitoring the active cases, which amount to 268. As I said before, 8 hospitalizations and 3 COVID-19 related deaths. Now, I need to provide you an update on the COVID-19 outbreak at Her Majesty's Prison. Now, on July the 1st, yesterday, we identified an additional 13 inmates who have been diagnosed with COVID-19. And so yesterday, we identified 13 new cases within the prison system. So this brings the total number of inmates diagnosed with COVID-19 to 55. 5 inmates have been diagnosed with COVID-19 related to this outbreak. But it's important to note that 40 of these inmates are well on their way to recovery. We had a mass testing at Her Majesty's Prison 2 days ago, and 40 of these inmates, they have received their first negative test. They were retested today, and we are hoping, we are keeping our fingers crossed that they would, their tests would return negative. In order for you to be deemed recovered from COVID-19, you will be serially tested until we get 2 consecutive negatives. When you get 2 consecutive negatives, you are deemed recovered. And so we are hopeful that within a few days, 40 of the 55 inmates would be deemed recovered. Now, at present, in terms of the staff at the Her Majesty's Prison, we have identified a total of 8 staff members who were positive with COVID-19. Now, 6 were identified yesterday, so 6 staff members recently diagnosed with COVID-19, 2 at the beginning of the outbreak in the prison. Now, 2 of these 2 original staff members, they have since recovered. So we have 6 active cases amongst the staff at Her Majesty's Prison. So this just provides you an update on the COVID-19 outbreak at Her Majesty's Prison. The SARS-CoV-2 variant that is in circulation in the Federation is the Lambda variant. We shared this information, a few days ago. Now, this variant, the Lambda variant, was first identified in Peru in August of last year. It has since spread to over 29 countries globally. It's quite prevalent in the South American countries, including Argentina, and it is in circulation here in the Federation of St. Kitts and Nevis. To date, we can say it's definitely more transmissible than the variant that we identified last March 2020. Now, this week, Wednesday, June 30, the previous batches of COVID-19 vaccine, they expired. So the previous batches of COVID-19 vaccine that we received earlier, they expired on June the 30th. Now, on June the 30th, at the end of Wednesday, June the 30th, a total of 18,913 persons were deemed fully vaccinated. In other words, they received their 2 doses, and this amounts to 57.2% of the target population. And we achieved a coverage of 69.4% of the target population receiving their first dose. So in essence, at the end of workday Wednesday, 41,850 doses of the AstraZeneca Oxford vaccine were administered. Now, we have received a number of questions. So 41,850 doses of the AstraZeneca Oxford vaccine, that's more than what you received. Now, we were sent, the Federation, we received 41,600 doses or 4,160 vials. But it's important to note that from some of these vials, we were able to get more than the 10 doses per vial. The nurses would tell us that, you know, from one vial, you may get 12 doses from a vial. And so that's why we were able to administer more than what we were officially, you know, given. So again, we administered 41,850 doses of the AstraZeneca vaccine. Now, our vaccine, even though the first batch expired, our vaccine program continues. Ladies and gentlemen, the way forward, what's the way forward? As individuals and collectively, we need to adhere to the COVID-19 protective measures and behaviors. So that's the way forward. These are the measures that's going to get us out of this wave of infections and out of this pandemic, meaning these measures are going to protect us from the virus. And for one, it's sheltering in place, because here in St. Kitts, we are in a lockdown until about the 12th of July. And so we are asked to shelter in place, only leave if it's essential. So if you're an essential worker or on the days of limited operations and you need to get groceries or go to the bank, you need to remain in place unless, you know, you're moving for an essential reason, an important reason. We need you to wear your face mask. That's very, very important. Once you leave your home, once you're going out into the public spaces, you need to wear your face mask. We want you to sanitize your hands after touching those high-touch surfaces. That's very important. We need you to maintain that safe distance of 6 feet from others. Whenever you go to the grocery stores, supermarkets, pharmacy, please maintain that safe distance. And it's important also to boost your immune system. I want to also add those individuals who are part, you know, if you're a member of a household whereby there is, you know, if you have a relative that's diagnosed with COVID-19, it's important for those individuals within that household to wear your face mask, sanitize your hands before and after interacting with the individual who is diagnosed with COVID. And, well, I must say that you should have minimal contact with the individual who is diagnosed with COVID. That individual should be self-isolated in his or her room and should have an assigned bathroom, restroom, whereby, you know, the individual alone uses that bathroom or restroom. If that's not the case, it's important to sanitize before and after using the restroom and maintain that safe distance from the individual who is diagnosed with COVID-19. And again, we all need to boost our own immune systems. Thank you.
Thank you very much, Dr. Hazel Laws, our Chief Medical Officer. I now invite to the podium to bring remarks the Permanent Secretary in the Ministry of National Security, Mr. Osmond Petty.
Thank you, LaJoy. I would first want to give a brief overview of the vaccination situation at the prison, just to get our statistics straight. There are 179 inmates at the prison, Her Majesty's Prison, of which 89 have been vaccinated. That is just about 50%. 64 of that 89 have been fully vaxxed with their 2 doses, and 25 have had 1 dose. Among the staff, there are 70 staff members in St. Kitts HMP, and 52 have been vaccinated, roughly 74%. While in Nevis, there are 19 staff members, of which 9 have been vaccinated. This is just around, 69%. When, a few weeks ago, we understood that, or we learned that inmates had tested positive for COVID-19, as the CMO said, the total at that time was around 40, or is. Immediately at the prison, the Commissioner of Corrections met with myself, Mr. Saunders, General Saunders, the NSA, and we put in place a number of mechanisms. The main prison hall was divided into 2 sections, where the 40 inmates who were positive were totally isolated from the rest of the prison population. And it worked. There was no contact whatsoever between those who were tested positive and the other inmates. But testing continued, and as we learned yesterday, 13 other inmates returned positive results. I want to stress that those 13 were not in any way contaminated by the previous 40 because they were isolated. The important point to note, though, is that the first 40 have now tested negative with their first test recently, and they're getting the second test, and hopefully all of them will be confirmed negative again, which means that they can be moved out of the isolation section at the prison. I've said to the Commissioner of Correction that we will not put them back immediately with the other prisoners, but we will sanitize a few cells and keep them by themselves for a few days still, even though they will be tested negative, so that we make sure that there is no possibility of contamination. And so as it stands, hopefully within the next day or so, there will only be 15 positive inmates at the prison. We have asked the Ministry of Health for PPE supplies, and I'm pleased that I reached out to the PS of Health, Mrs. Dr. Dolores Stapleton Harris, and I'm pleased that today or yesterday and continue today, we picked up about 300 PPE suits, a quantity of sanitizing liquid and so on to be used at the prison. And so the prison is coping very well with the COVID-19 isolation. The numbers are down. It's only 15, and we hope that even though testing will continue, that it will stay and keep going down. I want to say that there's absolutely no reason for panic at the prison, that everything is under control, that those who have tested positive have been totally isolated. There is a building at the prison which was recently built in the compound, about two or three floors. One floor is dedicated to cells, and there are about 25 prisoners in there who are negative, and every effort is being made to keep them totally isolated from all the other prisoners at Her Majesty's Prison. The staff, as we've learned, there are 6 active cases at this moment, and we continue to encourage staff to be vaccinated. As I said, it's just about 70% average who have been vaccinated so far, and we'll continue our efforts to encourage the staff at the prison to be vaccinated. Thank you.
Thank you very much, Mr. Petty, the Permanent Secretary in the Ministry of National Security. I recognize among us the Honorable Wendy Phipps, co-chair of the Disaster Mitigation Council, and additionally the Minister of Health, the Honorable Akila Byron Nisbet. I would invite to the podium now Superintendent of Police Cromwell Henry to update us on the laws with respect to the regulations.
Thank you very much, Mr. Williams. A pleasant good afternoon to all listening to this broadcast via whatever means. The COVID-19 task force has confirmed reports of persons who are confirmed COVID-19 cases in isolation has been seen in public at business places in Bastille over the last 2 days of limited operations. The task force takes a very dim view of persons who act responsibly and puts the public at risk. The persons in question have since been placed in government quarantine facility pending their recovery. The Commissioner of Police has directed that these incidents be investigated with a view to bring criminal charges against these persons if necessary. Section 15B of the Public Health Act provides as follows. A person who refuses or omits to do any act which he or she is required to do by this act or the regulations, or to carry out any order, instruction, or condition lawfully made, given, or imposed by any officer or other person acting under the authority of this act commits an offense and is liable upon summary conviction, where no other penalty is specifically imposed therefor, to a fine not exceeding $10,000, or to imprisonment for a term not exceeding 6 months, or to both such fine and such imprisonment. We remind persons who are in quarantine or isolation that the main condition of your quarantine or isolation is to remain confined to your home or any place that is approved by the Chief Medical Officer. As I mentioned before, any failure to comply with these conditions will be investigated and criminal charges will be brought where appropriate. Today is the last of 2 days of limited operation days. While we have seen some improvement over last year, we still saw instances of overcrowding at some establishments and a lack of physical distancing in some of the lines. In some cases, persons were not properly wearing their face masks, if at all. Remember, these basic protocols are intended to prevent the spread of the virus and are requirements of the regulations. Over 300 tickets have been issued to date for breaches of these regulations. A period of 24 hours curfew begins at 6 p.m. this evening and continue until Wednesday. During this period, all persons are expected to remain confined to your residences unless you are an essential worker required to report for duty or are exempted by the Commissioner of Police. Remember, churches are also required to remain closed. However, they may conduct their services using virtual means. The Commissioner of Police have approved for up to 10 persons to be at the church to record or to broadcast the service. For those essential workers who are out or on your way to or from work, from time to time you will encounter police checkpoints or police patrols who will stop you to verify that you are permitted to be out. We ask that you please cooperate with the officers and provide whatever documentation you are required to have, in most cases your ID or letter of permission. It does not mean that because you are an essential worker, the police will not stop you or even question you. Please cooperate and do not be confrontational. In closing, I just want to make one announcement from the Inland Revenue Department. The Inland Revenue Department has announced that all taxes due in June have been extended to July 31st. Therefore, persons with vehicles ending with 6 and 7, the deadline for the licensing of these vehicles is now July 31st. Please note that the vehicle inspection requirement is waived, and those persons who have driver's licenses who are expired, you can renew your license, your driver's license online, as well as your vehicle license. The field that requires you to upload your vehicle inspection, you may upload your insurance certificate in that field as well. So you would upload your insurance certificate in the insurance certificate field, as well as the vehicle inspection field, to allow the process to complete. If your vehicle is not insured, we ask that you not drive, because we have not exempted persons from the requirement to have your vehicles insured. Thank you.
Thank you very much, Dr. Wilkinson. Sorry. I guess my mind was on Dr. Wilkinson. Thank you very much, Superintendent Henry. That brings us to the question and answer segment for today. The first set of questions come from Vaughan Radio in Nevis. Did case number 16 come into contact with case number 15? And can you provide an update as to how case number 16 contracted the disease on Nevis? Suppose Vaughan Radio being in Nevis, they're speaking about all the Nevis cases.
The information that we gave was that these cases had no history of travel. Same cases in community spread. These cases were picked up incidentally in Nevis, which means that Nevis also has community spread.
Thank you, Dr. Wilkinson. This question is also from Vaughan Radio, Ashemika Bajan in Nevis. Owing to the lockdown, which comes into effect on Saturday as of 6:01 p.m., will students be allowed to continue sitting their exams on Nevis?
Good afternoon. Yes, persons will be able to sit their exam just as we've been doing in St. Kitts. The same will apply in Nevis.
This question is from SKN Newsline. A situation was explained to SKN Newsline by a concerned family member of someone who was in quarantine, then tested positive for COVID-19. According to the source, no one else in the family has been tested, but they worry they have been exposed. What is the policy on testing in this kind of situation?
I want to say just because it came in as a question doesn't mean that it is rooted in facts. Once a person tests positive, contact tracing is begun, and the immediate contacts, which includes the family, those persons would be the first in line. And so there is not a situation that the team would be aware of where a family member would be testing positive and the other family members would not be considered in the contact tracing process.
Thank you again, Dr. Wilkinson. The next question is also from SKN Newsline. For the return of cruise tourism, please clarify the position in regards to the vaccination status for crew and passengers. Earlier, we were told that all crew and passengers must be vaccinated. Is this the existing policy for visiting cruise ships?
Thank you again, Lesroy. We are currently in a community spread, and so all efforts right now is geared towards making sure we can be able to bring down our numbers and get our curve back down to the lowest level. Yes, indeed, we are also reviewing all protocols, which also include protocols for the crews. And so in due time, the information will be shared in terms of the revised protocols for crews, persons traveling in, as well as how we continue to live with COVID-19 as well.
Thank you, Minister Byron Nisbet. This next question, can you tell us if all of the vaccines were utilized, or did we have to discard some?
That's why I want to deal with this with some depth. The CMO indicated in her presentation that we got 4,160 vials. 4,160 vials that were supposed to be used on or before the 30th of June. And we have said here previously that after the 30th of June, we would not be using any from that stock. These 4,160 vials were intended to deliver a minimum of 41,600 doses. It is not unusual for vials to be overfilled, sometimes up to 12 to 15%, because the manufacturers have to account for spillage and dead space in the needles, etc. Therefore, if you got a vial that is supposed to deliver 10 mils, it will always have in more than 10 mils. Therefore, if one were to use all 4,160 vials, depending on who was delivering and the amount of spillage, you could actually get more of the expected doses or less. Here in the Federation of St. Kitts and Nevis, we were happy that in using the vials that we were provided, we were able to get more than the minimum amount that was expected. So instead of delivering 41,600, we got an additional 250 doses. On a daily basis, sometimes we would get 8 doses from a vial, sometimes 10, sometimes 11, sometimes 12. And so in averaging over the 3+ months that we were administering the vaccines, we got an additional 250 doses. Now, there were 17 health centers across the Federation of St. Kitts and Nevis involved in the vaccination process that ended about 5 o'clock on the 30th of June. Now, just using basic reasoning, it will follow that at 5 o'clock, every single vial will not be empty. And so around the Federation, there would have been vials that had liquid in them still. And so to ask if some were discarded, of course. The most important thing is that none would be used after the 30th, which is passed. And the most important thing also is that we got more than the minimum amount that we were supposed to get. And so I want to thank again all of the persons from the Federation who came forward in a timely manner and got vaccinated. And I also want to thank all of the persons who were involved in the education and the rollout program, such that the Federation of St. Kitts and Nevis is in a much safer place today compared to the 22nd of February when we started the rollout. And I do hope and trust that that is the last question we'll be answering regarding the doses. Thank you.
Thank you, Dr. Wilkinson. That brings us to the end of our question and answer segment. Thank you very much for addressing those questions. Now, there are some announcements that I want to make. The Prime Minister, in his address today, said that St. Kitts and Nevis, through bilateral diplomatic arrangements, was able to secure an additional 5,000 doses of the Oxford AstraZeneca vaccines. These vaccines, he said, they have an expiration date of August 31st, 2021, and he also reported that the vaccination program, of course, which came to an end on June 30th, the first phase, that the vaccination program will be able to resume on Thursday, July 8th, 2021. So the vaccination program will resume on July 8th, 2021. Additionally, I would make this announcement that the National COVID-19 Task Force Chairman and the entire committee wish to extend a heartfelt gratitude to Claudia Sanchez and the Marriott Vacation Club for their generous donation of food items to help the vulnerable during this difficult time. The National COVID-19 Task Force also acknowledges the continuous corporate support by Flow, Digicel, and the Cable for their kind contributions to the national response, with their donation of 6 cell phones and 3 tablets for the social assistance team. The enhancement of the communications capability of the social assistance will enable them to be more efficient and effective in delivering the service of assistance to the public. We thank Mr. David Lake of Flow, Ms. Diane Emtage of Digicel, and Ms. Pat Walters of the Cable for their spirit of national responsibility. That brings us to the end of our press briefing for today. I want to thank Dr. Cameron Wilkinson, our Medical Chief of Staff, the Chief Medical Officer, Dr. Hazel Laws, the Minister of Health, the Honorable Akila Byron Nisbet, Permanent Secretary in the Ministry of National Security, Mr. Osman Petty. We thank Superintendent Cromwell Henry. We also thank, for their support, who is here, we have the Commissioner of Corrections, Mr. Terrence James, and we have the Honorable Wendy Phipps, who is the co-chair of the Disaster Mitigation Council. We also thank Dr. Marissa Carty, who is the Public Relations Officer at the HEOC. You would have seen her fill in for Dr. Laws the other day. And Dr. Carty works very, very hard. All those reports that we get in terms of the situation report and the vaccination reports, it is Dr. Carty that is actually behind those. We thank Mrs. Christmas Jacobs for her sign language support here at the NEOC, and we thank AJ, we thank John James, we thank the entire staff of ZIZ who continues to be dedicated to this NEOC briefing, and we thank all the media in the Federation. I can name all of them: Freedom FM, Win FM, KISS FM, what other FM? Sugar City FM, all the FMs and all the AMs, and all the newspapers and all media houses who continue to partner with us, especially at this difficult time of the COVID-19 pandemic. And we continue to thank them because we need them. They are our partners. And so therefore, we have the hurricane season, which we are in. And already we are seeing how active it is. We remember, the people in Barbados and St. Vincent and the Grenadines and other places that are now experiencing the brunt of Tropical Storm Elsa. Let us remember them in our prayers. It is now hurricane, I was told, so it means it is developing rapidly. We continue to hold them in our prayers while we continue to prepare here for any natural disaster. Thank you very much for joining us for our briefing today. We will be back at another time. Have a good weekend. I am Les Roy Williams.
Yeah, I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, yeah. One people. We are roll up to roll up. Yeah. 'Cause no man's alone. Do what's right. Alright. 'Cause I love you. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah.